Funding provided by the League of Women Voters Project Fund.
So let's move on to amendment number 72. Amendment 72, an initiated amendment to section 21 of the Colorado Constitution to increase cigarette and tobacco taxes. Major provisions: raise the state tax on a pack of cigarettes from 84 cents to $2.59. Increase the state tax on other tobacco products from 40% to 62% of the manufacturer's retail price. Distributes new tax money for medical research, tobacco use prevention, doctors and clinics in rural or low-income areas, veteran services, and other health-related programs, and exempts the tax revenue from the tax increase from the state's constitutional revenue limit.
Good evening. Thank you for having me here tonight. My name is Kristy Schmidt. I'm the Community Relations and Development Director at Marillac Clinic here in Grand Junction. Marillac is a community health center that provides health care, dental care, optical care for our lower income, middle income residents of Mesa County. So I'm here tonight to talk to you and show support for Amendment 72, which is the increase in tobacco tax in Colorado. In just a short statement until we get into it further, Colorado has not seen a tobacco tax since 2004. That was the first time they had done it. So it has been 12 years since that has occurred, and unfortunately cigarette sales are on an increase in this past year. We saw a decrease in sales over the last 11 years, which is a good thing for our state, because as you know, we want to be the healthiest state in the country. So we will talk further, and I can share more information and statistics about the reason to vote yes on Amendment 72. Thank you very much. So I just want to share with you a lot of data tonight that really supports why Colorado should increase the tobacco tax again. Amendment 72 is about stopping big tobacco companies from getting more kids and adults hooked on cigarettes and dying prematurely. The problem is this: we all know that tobacco kills. Over 5,000 people in Colorado alone die each year from tobacco and smoking. More than 659,000 adults and about 24,000 children in our state smoke. In Mesa County alone, in a last survey with our health department's needs assessment, there was over 27% of the high school students that have smoked in the last 30 days or used tobacco products. So it's a big problem here. When the state increased the tobacco tax in 2004 to 84 cents on cigarettes and a 20% increase on tobacco products, it worked. People stopped smoking. We saw a huge decrease in smoking over those years. The money it generated was around $175 million per year in that tax revenue that helped support a lot of important programs around prevention, cessation, research, taking care of the underserved like we do in our community. So the monies went to good use. Colorado's current tax is 38 in the country. So our state is 38 in the amount of sales tax that is charged for tobacco products. This increase of $1.75 on top of the 84 cents, like he had said, is about $200.59 tax on a pack of cigarettes, will generate around $300 million a year. Those monies are accounted for. They will support research. They will support prevention programs. They will support mental health for children and services for veterans. It will serve clinics and hospitals that serve the underserved. It will take care of professional clinical development to be able to bring doctors into our community to help pay for them to come to this community. So the dollars will be supporting important programs. If people want to smoke, that's their prerogative. They can smoke, but they should be paying for that. It costs our state almost $2 billion a year in health-related issues for tobacco or smoking. That's a lot of money that is spent on health care in our state. Almost $1.3 billion a year is spent on lost productivity to those employers that small businesses that rely on their workers to be able to come to work, they're losing that money on lost productivity. So here are some of the statistics I want to share with you tonight. I mentioned over 5,000 people a year die from cigarettes. $1.9 billion is spent on health-related costs each year from smoking and diseases from smoking. 1.3 billion is lost each year on productivity, and healthcare costs related to tobacco cost each of us, every household in Colorado, over $700 a year for those uncompensated healthcare costs that we're all paying for. 24,000 high school students in Colorado smoke cigarettes, and they spend or purchase 7.1 million packs of cigarettes a year. That is a lot of cigarettes that are being purchased by our teens. You may ask that, why would we want to increase the tobacco tax on some of the lowest income in our community, in our state? Those dollars can be spent on other things, more healthy things that they could be relying on than cigarettes, and just the risk of disease, the risk of other healthcare related issues to children that may live in their home. So the tobacco tax increase is only going to put Colorado at about 11th in the country. We're not going to be the top state in the country charging the highest tobacco tax. We still have room to grow. And it's been 12 years since we have increased the tax in this state. And it's time that we do increase that tax again to help cover these costs for research and healthcare in our state. So I think that's probably all I can share right now. I'll wait for if there's any questions. But thank you for listening tonight.
So opponents of Amendment 72 were unable to attend tonight, but have prepared a written statement. I will read that statement. Amendment 72 is a $315 million per year tax increase. This poorly drafted measure would block hundreds of millions of dollars in new spending into the state constitution for programs that have yet to be determined. We all want to help those who want to stop smoking, but this measure is the wrong approach. Here are 5 reasons to reject this constitutional amendment. 1, Amendment 72 blocks $315 million in new spending into the Constitution with no other way to change it without another statewide vote of the people, even in the case of waste, fraud, abuse, or budgetary emergency. 2, this measure comes with little accountability and virtually no oversight, as most of the revenue generated by this tax is dedicated to programs that haven't even been determined. In fact, 51% of new tax dollars fund grant awards where guidelines aren't even written yet. 3, this measure creates conflict of interest concerns because it dedicates $315 million in taxpayer dollars to state agencies to distribute grants to pet projects. The Colorado Department of Public Health and Environment, one agency responsible for awarding grants from new tax dollars, decided this year as needing stronger conflict of interest policies. 4, Amendment 72 dedicates less than 20% of new tax dollars to smoking prevention. More of the new tax should be dedicated to helping smokers quit or keeping kids from starting. But this is nothing new, as Colorado already has received more than $1.6 billion from tobacco companies that could be used for tobacco prevention and treatment. But the state has spent most of that revenue on unregulated government programs. 5, finally, Amendment 72 ignores other pressing needs of Colorado families. Colorado is facing some very real challenges like insufficient school funding, rising cost of living, crumbling roads and bridges, and immigration and population growth. Amendment 72 does not dedicate a cent to helping solve these issues. For these reasons, we encourage you to vote no on Amendment 72. Please visit noonamendment72.com for more information. So, question 1, will funds go towards smoking cessation and helping those addicted? What do you say about tripling the financial burden to addicted individuals, some of which are lower income?
Yes, there are monies earmarked for smoking cessation, so exactly $54 million for tobacco education, prevention, and cessation programs for Colorado youth and adults. So that has been earmarked, if that's where the funds would go. And I know it was stated earlier that they felt like, or the opposition felt like there were locked funds, I guess you could say, for that. And that is inaccurate because in the details, it does spell out exactly where those funds would go to what programs, and that there would be grants that would have to be applied for, competitive grants, for to have funding available to any organization. And the other was about low income? Low income populations.
That's correct. What do you say about tripling the financial burden to addicted individuals, some of which are lower income?
And that is something we see every day in our organization because that's the population and the patient we serve. But low-income populations really stand to gain the most because they're far more likely to quit. And it was proven when the first tax increase occurred in 2004 that there was a huge decrease in the number of smokers because of the tax increase. It's also going to allow them to save between $1,000 and $2,300 a year, depending on how much they smoke. So it's a cost savings that they can have better health, they can pay less for their health care, they can earn more, have more spendable income for other healthy things.
Staying on 72, do we know which groups, orgs, individuals opposed the amendment?
Yes. The big opposition, of course, is the tobacco company. There's one large tobacco company out of Virginia that is spending $10 million in the state of Colorado right now on negative ads. And I'm sure you've seen them about questioning where's the money going to go. And so it's spelled out very clearly in the amendment where the money is going to go, how it's going to be utilized, and it's all written in the ballot. So you can go to your ballot or blue book and be able to read the details. But all of that is coming from the one big tobacco company.
72, does this have to be a constitutional amendment?
Yes, it does. In order to raise increased taxes, it has to be in the Constitution.
Okay. Sticking with 72, how do we know Amendment 72 will be spent on health issues?
I do have that here, and we do know that because, let me find my notes here. I know I have one minute. Oh, here it is. So the question is, how do we know it will be spent on health issues? So I think one of the issues that Big Tobacco had was that there was no accountability. That wasn't true because what they say is that the guidelines for the grant programs are outlined in implementing legislation as it was done in 2005, the previous cigarette tax increase. State taxpayer expenditures are subject to multiple levels of accountability and oversight from the executive office, legislature, and office of the auditor. So there is oversight, ensuring that the dollars are spent appropriately on the programs designated.